Patient and public involvement and engagement, or PPIE, is a cornerstone of high-quality human clinical research. Evidence shows that involving patients, caregivers, and the public in designing and conducting studies makes research more relevant, ethical, and impactful. Despite its success in human medicine, PPI principles are rarely applied to research involving animal patients. Humanimal Trust is addressing this through Public Guardian Involvement and Engagement, or PGIE, which adapts the principles of PPIE to veterinary medicine, bringing animal guardians, professionals, and the public into discussions about ethical research. It supports the One Medicine ethos, which aims to provide equal opportunities for humans and animals to benefit from healthcare advances. PGIE is advisory, not directive. It complements, rather than replaces, professional judgment and existing ethical frameworks. When applied effectively, PGIE can enhance study design, transparency, trust, and relevance, without compromising animal welfare or adding unnecessary burdens. In human research, PPIE makes sure that patient studies are relevant to what patients actually want and need. Patients help identify research questions, co-design study protocols, review materials like consent forms, and participate in advisory panels. Evidence shows that PPIE can improve recruitment, retention, feasibility, and outcomes meaningful to participants. Importantly, it can raise ethical standards by identifying potential concerns early, ensuring that studies respect lived experience as well as scientific rigor. Research with animal patients can face similar challenges. Animal patients, however, cannot advocate for themselves, and PGIE applies the perspectives of animal guardians and wider stakeholders to try to address this gap. Animal guardians represent the voice of the animals. They can highlight outcomes that matter in everyday life, assess whether studies are practical and acceptable, review communications for clarity, and advise on ethical considerations when interventions involve uncertainty or risk. In this way, PGIE aims to align with professional standards, strengthen decision-making, and foster trust without undermining clinical expertise. Ethical alignment between human and veterinary medicine is important for the success of One Medicine. Similar to PPIE in human patients, PGIE emphasizes animal patient-centered ethics, prioritizing welfare, quality of life, and proportionality of burden. This approach strengthens trust, improves study design, and enhances the translational value of research for both humans and animals. Humanimal Trust has started the process of developing an ethical framework for animal patient research through a co-designed PGIE process. This involved animal guardians, veterinary and human healthcare professionals, and members of the public, ensuring all voices were heard. 5 core principles emerged: clear definitions of clinical research, prioritizing animal welfare and quality of life, professional governance and support, transparency and trust with guardians, and alignment with human clinical research where appropriate. When completed, we hope this framework will ultimately provide ethical guidance for vets, reassurance for guardians, and safeguards for animal patients. We believe the benefits of PGIE and this framework will be multifaceted. For vets, it will clarify ethical decision-making and professional responsibilities. For animal guardians, it will provide confidence that their animal's welfare is paramount and that participation is fully informed. For animals, it will ensure that research is ethically justified, minimizing harm while maximizing quality of life and relevance. By integrating human and veterinary principles, PGIE supports One Medicine, advancing collaborative research that benefits multiple species ethically and effectively. In conclusion, PPIE has transformed human clinical research, demonstrating the value of meaningful involvement in improving science and ethics. PGIE aims to adapt these principles for animal patient research, ensuring that animal patients, guardians, and professionals are central to research design and oversight. By combining co-designed ethical frameworks with a commitment to welfare, transparency, and collaboration, Humanimal Trust hopes to help animal patient research evolve responsibly, benefiting animals, humans, and the broader goals of One Medicine.